Due to the COVID-19 pandemic, the world stops. But not the determination of others to be a registered professional. Welcome to our online quiz.
Hey guys, so welcome to our online lecture. I'm Sir Jonas Marvin Anake. So this is our Nursing Practice 1 lecture and it's all about your blood donation program. Okay, so let's begin with the situation. You will start working as a field nurse at the Philippine Red Cross. You are reviewing the Republic Act 7719 or the Blood Services Act of the year 1994. This law ensures a safe and accessible blood supply by promoting voluntary blood donation. Okay, so question number 1. The following are characteristics of a donor donating blood. Number 1, be in good health condition. Number 2, weigh at least 110 pounds. Number 3, be 17 years of age and older. And number 4, carry a valid identification card. Or number 5, be at least 5 feet tall. Or number 6, never had an accident. So, to ensure the safety of blood supply, donors must meet which of the following before donating? A. 1, 3, 4, and 5. B. 1, 4, 5, and 6. C. 1, 2, 5, and 6. Or letter D. 1, 2, 3, and 4. So, what is your answer? So, is it A, B, C, or D? Okay, so in your question number 1, the correct answer here is letter D. Okay, so letter D is the correct answer. So 1, 2, 3, and 4. So to ensure the safety of blood supply, the donor must be in good health condition, must weigh at least 110 pounds, and must be 17 years of age and older, and must carry a valid identification card before donating. Okay, so in your criteria or requirements of a potential blood donor, it includes number 1, be in good health condition. Number 2, the weight should be at least 110 pounds or 50 kilograms. And number 3, blood volume collected will depend mainly on the body weight and not in your height. Okay? And number 4, the pulse rate must be between 60 and 100 beats per minute with a regular rhythm. And the blood pressure must be between 90 and 160 systolic and between 60 and 100 diastolic. And syempre, ang pinaka-importante dito, hemoglobin count also must be at least 125 grams per liter. Okay? So, these are the requirement or the basic requirement of a potential blood donor in blood donation program. Okay, the next question number 2, you are aware that a person is still eligible to donate blood in which of the following conditions? A. Taking antibiotics or maintenance medications. B. Pregnancy and recent childbirth. C. Having a high or low blood cholesterol. Or letter D. Having used self-injected non-prescribed drugs. So, among which of this person is still eligible to donate blood? So, elimination technique. First, we must eliminate letter D, having used self-injected or non-prescribed drugs. Because in your letter D or option D, that is an absolute contraindication for blood donation. Okay? So, yung letter A naman, taking antibiotics or maintenance medication, that is a temporary contraindication. So, still, hindi pa rin siya eligible to donate blood kapag siya ay undergoing maintenance or antibiotic therapy. Okay? So, between letter B or letter C, the correct answer here in your question number 2 is letter C. Having a high or low blood cholesterol is still eligible to donate blood. Okay? Pregnancy and recent childbirth is a temporary contraindication for blood donation. So, there are certain conditions that prevent a person from donating blood temporarily or permanently. Among the temporary conditions are the pregnancy and anemia, acute fever, recent alcoholic intake, ear or body piercing and tattooing, and surgery. Okay, so these are the temporary conditions that will prohibit blood donation. Okay? And persons with the following conditions are not allowed to donate blood anytime. So, yung may mga cancer, cardiac disease, severe lung disease, hepatitis B and hepatitis C because these are blood-borne diseases, HIV infection, AIDS or any sexually transmitted diseases, high-risk occupation like prostitution, and anyone who has ever used intravenous drugs like your illegal IV drugs, especially man nagse-self-injection, okay? So, these are the contraindications for blood donation. Cancer, cardiac disease, severe lung disease, hepatitis B and C, HIV infection, AIDS, or any sexually transmitted disease, prostitution, and a person who self-injects blood, okay? So, yun po yung ating mga contraindication for blood donation. Next, question number 3. You keep a list of walking blood donors. You mobilize the community to register in this list with their blood types. Some instruction for blood donors are the following. Number 1, register at any blood center unit in a government hospital. Number 2, go to any hospital or clinic and register as a potential blood donor. Or number 3, your complete health history will be taken. And number 4, you will be given honorarium upon registration. And number 5, a physical examination and your vital signs will be taken. And number 6, a blood test will be taken to determine your blood type. So, which of these will you include in your instruction? Okay, so letter A, 2, 3, 4, and 5. Letter B, 1, 3, 5, and 6. Letter C, 1, 4, 5, and 6. And letter D, 2, 4, 5, and 6. So, among which of these will you include in your instruction? Okay. So, syempre, kapag ikaw ay magiging walking blood donors, number 1 na gagawin mo dyan is to register at any blood center unit in a government hospital. Okay? So, number 1 ang mauna dito. Then next, your complete health history will be taken. Then, number 5, a physical examination and your vital signs will be taken also. And last is a blood test will be taken to determine your blood type. So, the correct answer here in your question number 3 is letter B, 1, 3, 5, and 6. Kasi yung number 4 natin, mali po yun kasi wala namang ibibigay na honorarium sa iyo kapag ikaw ay magbibigay ng blood donation. Okay? So, mali po yung ating option number 4. So, the correct answer here is letter B. So, before blood donation, ang gagawin mo dito is fill up a donor's form upon arrival at a blood collection site. Then, health history will be asked by a trained professional staff. Then, pre-donation education and counseling will be given by a trained professional. Then, your weight, your blood pressure, or the vital signs will be checked and you will be examined by a physician. So, a small sample of your blood also will be taken to check your blood type and hemoglobin level. So, napaka-importante po yan, okay? So, in any blood donation or bloodletting activity, kailangan alamin natin yung blood type and the RH factor of your clients, okay? So, the correct answer here is letter B. The next question, number 4, after donating blood, you advise the donor to do the following and expect to A. Increase fluid intake following blood donation. B. Skip the next meal to allow the body system to rest. C. Leave the adhesive dressing from 3 to 6 hours. Or letter D. Avoid carrying or lifting heavy objects using the donating arm. Okay, so alin dito yung i-expect natin? And ano dito yung i-advise mo sa donor after donating blood? So, letter A, letter B, letter C, or letter D, the correct answer here is letter A. Expect to increase fluid intake following blood donation. So, letter A is the correct answer. So, after blood donation, you will be advised to rest for 10 more minutes. Okay, 10 more minutes only. So, beverages and simple snacks will be served. Post-donation education and counseling will be given by a trained professional staff. And you will be advised to drink more fluids. The volume of fluids taken is completely replaced by the body within 3 to 5 hours. Okay? So, yan po yung ating i-advise after blood donation. So, letter A is the correct answer. So, advise the client to drink more fluids after donating blood. And last question for today, we have your which of the following statements is not true about the benefits of blood donation? So, not true. So, negative po ang ating hinahanap na sagot dito. So, about the benefits of your blood donation. So, A, enhances production of new blood cells. B, blood donation burns calories. C, blood donation reduces cancer risk. Or letter D, blood donation is good prevention against infection. So, which of the following statement is not true? Okay, so take note that your blood donation is a way to enhance production of a new red blood cells, And also, your blood donation will burn calories and reduce your cancer risk. So, the correct answer here is letter D, because this is not true about the benefits of blood donation. Blood donation will not prevent infection. So, letter D is the correct answer. So, take note, nurses, that blood donation helps in lowering the risk of cancers, and it stimulates the production of new blood cells, and in return, it helps in maintaining good health. So, regular blood donation reduces the weight of the donors by burning calories. So, that is according to the researchers at the University of California, San Diego, that have found that you can lose up to 650 calories per pint of blood donated. Okay? So, the correct answer in your question number 5 is letter D. Blood donation will not prevent infection.